Hello, hello, hello. Good evening. Happy Monday, 23rd of August. Okay, I am still alone. Let me hang a bit. Let's see. Let us remind our partners to join us. Hello, hello, hello. Good evening. Happy Monday. Hello, leaders. Our partners to join us. Let's remind our partners to join us, please. Let us share the link. Let us share with every member. Today, nobody's supposed to miss this one. I'm trying to remind everyone now. Let us please share the link. Let's please share. I will start. It's 1901. So let's see, around 1904 that we start. Let's just invite our partners, pretty please. I'm trying to remind leaders as well on my side. All right, the numbers are picking up so wonderfully. Happy Monday, great leaders. Hello, hello, hello. Onalena, my person, leader mod. Hello, hello. Remember, in Longrich, we say good morning, no matter the time. So let us fix that. We say good morning. Oh, yeah. Let's see. Let's see. Leaders, let's remind, we're starting in 2 minutes. It's 1904. Or as soon as we reach 20, which is one person short. It's now way over 20. Good evening, everyone. Good evening for leaders. How is everyone doing after the seminar? Yes, Yetunde. Good morning. In Longrich, we say good morning. There's no good evening. There is no good evening. Viv, hello, my darling. Good evening. Is everyone well? How was the seminar, guys? How was the seminar? Are you fired up? I am so fired up. You? We're gonna start just now. Let's keep inviting. Let's keep inviting. We start. Are we ready? Can I go? Hey, my SD5. Let me put on both. Hey, but this side is going to. Okay, I'm starting now, leaders, ne? Yeah, all right. So today we are discussing the hot topic that we normally don't take very serious, oral health. Oral health. Today, ladies and gentlemen, after the show, we are all going to brush our teeth. Okay, let me start. Wow, you are revived, leader Mukamuko. I'm so happy. Leaders are actually very happy. We are so excited about this. Okay, great leaders, oral health. Please, let me remind you again, we're going to do like last week. You will ask the questions when I'm done. When I'm done, you'll ask the questions from around 7:45, 7:50. Yes, we can talk, we can communicate. Right. We need to follow what our teachers used to teach us. You know, in class, the teacher will teach. Then at the end of the lesson, they'll give you the flow. So let's start practicing that. So oral health. Your oral health is more important than you might realize. Learn how the health of your mouth, your teeth, your gums can affect your general health. Did you hear that? General health. So, did you know that your oral health offers clues about your overall health, or that problems in your mouth can affect the rest of your body? Protect yourself by learning more about the connection between your oral health and overall health. So what is the connection between oral and overall? Like other areas of the body, your mouth teems with bacteria. So they team up. Mostly harmless, right? But your mouth is the entry point to your digestive and respiratory tract. And some of these bacteria can cause disease. Normally, the body's natural defenses and good oral health care, such as daily brushing and flossing. You know, Longrich must make flossing. Longrich flosses. So I was saying, normally the body's natural defenses and good oral health care, such as daily brushing and flossing, keep bacteria under control. However, without proper oral hygiene, bacteria can reach levels that might lead to oral infections, such as tooth decay and gum disease. Another thing, leaders, certain medications, such as decongestants, antihistamines, painkillers, diuretics, and antidepressants can reduce saliva flow. Saliva washes away food and neutralizes acids produced by bacteria in the mouth, helping to protect you from microbes that multiply and lead to disease. For leaders that have been following my teachings, I don't have to explain what are microbes, right? It's those tiny microscopic things that you can't see that are everywhere. The air, the water we drink, yeah, they're everywhere, microbes. That's why even our, like your moisturizers, they have antimicrobial ingredients, including our SOD, actually everything. Our SOD has it, our coffee has it, yeah. Studies suggest that oral bacteria and the inflammation associated with a severe form of gum disease, which is called periodontitis, might play a role in some diseases. And certain diseases such as diabetes and HIV/AIDS can lower the body's resistance to infection, making oral health problems more severe. I hope we are together. I hope we are together. Today we are learning more than ever. Okay, let me just scroll down. So how teeth affect your health? Your teeth can affect your oral health in a number of ways. As the condition of your teeth worsens, they become prone to cavities, the holes, and tooth decays. Bacteria easily attach to them, right? They make your teeth weaker. You are not able to chew with them properly and face constant pain. Their poor condition leads to a number of diseases like your periodontitis, diabetes, heart disease, rheumatoid arthritis. I hope you are listening. Lung conditions and obesity. As you cannot chew properly, you don't eat a lot of food, and the requirements of your body aren't fulfilled, which makes you weaker and leads your body to a number of other health risks. I hope we're learning. Okay, so back again. What conditions can be linked to oral health? I'm going a bit deeper. I did mention that diabetes and everything, but I'm going a little bit deeper. Your oral health might contribute to various diseases and conditions that include something called endocarditis. This is an infection of the inner lining of your heart chambers or valves, endocardium. Typically occurs when bacteria or other germs from another part of your body, such as your mouth, spread through your bloodstream and attach to certain areas in your heart. That's endocarditis. Right, another condition, cardiovascular disease. Although the connection is not fully understood, some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. I hope you're taking notes. Right. The other thing, pregnancy and birth complications. Periodontitis has been linked to premature birth and low birth weight. Remember, I said, please ask questions from 7:45 to 8 when I hand over the floor to you, right? Not now. So if you ask a question, I don't see anything. I'm on my notes right now. Okay, so you'll have to retype when I give you the floor. Right. Other conditions. Pneumonia. Certain bacteria in your mouth can be pulled into your lungs, causing pneumonia and other respiratory diseases. Certain conditions also might affect your oral health, including sugar diabetes. By reducing the body's resistance to infection, diabetes puts your gums at risk. Gum disease appears to be more frequent and severe among people who have diabetes. Research shows that people who have gum disease have a harder time controlling their blood sugar levels. Regular periodontal care can improve diabetes control. Another condition that can affect your oral health, HIV/AIDS. So there's 4. I started with diabetes, and then now I'm on the second. HIV/AIDS. Oral problems such as painful mucosal lesions are common in people who have HIV or AIDS. The third one, osteoporosis. This bone weakening disease is linked with periodontal bone loss and tooth loss. Certain drugs used to treat osteoporosis carry a small risk of damage to the bones of the jaw. Alzheimer's disease, that's the fourth one. Worsening oral health is seen as Alzheimer's disease progresses. Hey. Other conditions that might be linked to oral health include eating disorders, rheumatoid arthritis, which I mentioned, certain cancers, and an immune disorder that causes dry mouth called Sjogren's syndrome. So now, tell your dentist about the medications you take and about changes in your overall health, especially if you've recently been ill or you have a chronic condition such as diabetes. Hey, leaders, there's a lot of info on this. There's a lot. So, for those who don't know what's periodontitis, it's when bacteria store itself on your teeth. The chances of gum infections are increased to a higher level. As your immune system senses the infection, it takes action, which makes your gums inflamed. Long-term inflammation and the chemicals it releases can eat away your gums and bones that hold your teeth in place. And then with diabetes, I'm going into it a little bit deeper again. Due to a lack of insulin, your body struggles to process sugar. Periodontal diseases or poor oral health makes it more difficult for your body to produce and use insulin. If your teeth are infected and the sugar level in your blood is high, it will lead to the growth of infection in all parts of your body, especially your mouth. This cycle can get out of control easily. The cycle of high blood sugar level. This one was worrisome. Heart disease. According to multiple types of research, 91%, I hope you're writing this down, my leaders. According to multiple types of research, 91% of heart patients also suffer from periodontal diseases and mouth infections. Now I'm telling you who are your customers, by the way. 66% of people without heart diseases suffer from periodontitis. Hence, there is a strong connection beyond similar risk factors like obesity and smoking, etc. Inflammation in the mouth may cause inflammation in the blood vessels. Did you hear that? Inflammation in the mouth may cause inflammation in the blood vessels. This increases the chances of a heart attack in a heart patient by allowing a decreased inflow of blood between the heart and the rest of the body parts. It also causes an increase in blood pressure. With osteoporosis, this disease also leads to weakness in your bones. Some experts say that this affects more women than men and affects the long bones in arms and legs. So what is it called? Tibia fibula. Women with osteoporosis are more likely to have gum diseases than women who don't. I repeat, women with osteoporosis are more likely to have gum diseases than women who don't. Now, with rheumatoid arthritis, treating periodontal diseases can lead to ease in pain caused by arthritis. Arthritis patients are also at a higher risk of catching periodontal diseases. I hope you are all learning. Now, before I go on to what we can do with the health, I'm almost done, my leaders. Now I am on the website of WHO, World Health Organization. Let me see. There's a part that I'm looking for. It is estimated that oral diseases affect 3.5 billion people worldwide. 3.5 billion people worldwide. And untreated dental caries, tooth decay of permanent teeth, was one of the most prevalent diseases globally in 2017. Poor oral health causes severe pain. I think all of us know that. Discomfort, and can lead to disfigurement, social isolation, and even death. Oral health inequalities exist among and between different population groups around the world and through the entire life course. There is a strong and consistent association between socioeconomic status, so income, occupation, education level, and the prevalence and severity of oral diseases. Most oral diseases and conditions, Most oral diseases and conditions share modifiable risk factors such as tobacco use, so smoking, alcohol consumption, and unhealthy diets high in free sugars, common to the 4 leading non-communicable diseases. The non-communicable diseases, my leaders, for those of us who are not health experts, let us see, what are they? Cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. Additionally, it is reported that poor oral health has been linked in a reciprocal way with other non-communicable diseases such as diabetes. And then in Africa, oral diseases are increasingly being recognized as a major public health problem in light of the rising non-communicable disease burden, as well as its common modifiable risk factors. Remember, I spoke about the tobacco use, alcohol use. It is reported that approximately, listen to this, it is reported that approximately 400 million people suffered from some form of oral disease in the WHO African region in 2017. So, due to a lack or unequal distribution of oral health professionals, a lack of appropriate facilities, and in many countries in Africa, no dedicated oral health budget, people incur significant out-of-pocket expenses to access oral health services, while most oral diseases in the African region remain untreated. Do we not have customers? Do we not have customers? You don't have to answer now. Let me go on to the last. So how can we protect our oral health? So the first things first, We practice good oral hygiene. We brush our teeth at least twice a day with a soft bristle brush using fluoride. Well, they say fluoride toothpaste. No. We are using non-fluoride, right? Just hold on a little bit, my leaders. Why did I forgot the toothbrush. Toothbrush along Richinat. You floss daily. I asked if we can get Longrich flosses. You use mouthwash to remove food particles, right? We use mouthwash to remove food particles left after brushing and flossing. So we brush our teeth first with, right? So my leaders, this one I still have to research, but I have researched a bit. The artemisinin does have fluoride in it. Our white tea toothpaste doesn't have fluoride in it. So it will be a personal preference. But a lot of people are raving about our artemisinin toothpaste. It's antibacterial there. Eliminates oral inflammation, protects gums, contains premium herbal extract. And obviously, we can't talk enough. We've spoken enough, I don't know. But seemingly, we don't speak enough about oral health because so many people are affected, right? Shabaka beke nana ya see through. Beke yaka ya see through. Okay? So, quality toothpaste. Eating a healthy diet and limit food with added sugars. So less sugar, even the salt, less salt, less of everything that's not good for you. Replace your toothbrush every 3 months or sooner if your bristles are splayed or worn. So if they are doing the banana split, change your toothbrush. Thank God we've got toothbrushes in Longrich. I'm almost done. Schedule regular dental checkups and cleanings. And the last one, avoid tobacco use. So smokers. I want to talk about our toothbrush, ladies and gentlemen, because wow, our toothbrush is really good. It really gets in between our, right? Let me just go over this once again, right? Since I did it quite quickly while I give my kids a chance to find our toothbrush. So, what conditions? Thank you. What conditions can be linked to oral health? Your oral health might contribute to various diseases and conditions, including, I said, endocarditis. This infection of the inner lining of your heart chambers or valves, called endocardium, typically occurs when bacteria or other germs from another part of your body, such as your mouth, spread throughout your bloodstream and attach to certain areas in your heart. Cardiovascular disease, and remember, cardiovascular disease is a group. So it will be your cerebrovascular disease, rheumatoid disease, your heart attack. So cardiovascular disease is a group of heart conditions, all right, which includes stroke as well. So although the connection is not fully understood, some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. Pregnancy, number 3. Pregnancy and birth complications, imagine. Periodontitis has been linked to premature birth and low birth weight. And the other one, pneumonia. Certain bacteria in your mouth can be pulled into your lungs, causing pneumonia and other respiratory diseases. Let us brush those teeth. So my leaders, I was talking about our Longrich toothbrush. This toothbrush, for me, it's as good as flossing because it really gets in there. And the other thing that's also advised, this is one thing I want to teach leaders. I'm not sure if all of you are aware of this. I'll tell you now. The first point I made about how we can protect our oral health was brush your teeth twice a day with a soft bristled brush. Soft, oh, soft. Where is it? I remember it was written somewhere. Our bristles are soft. You know why? Because these hard toothpaste, medium to hard. Remember, some of us, our strength is not the same. Some of us, we brush too hard, ne? And then the other thing is, you brush so hard that you literally brush off your enamel of your teeth, and teeth do not grow back. Teeth do not grow back. Once they're gone, oh. Okay. So teeth do not grow back. So these are some of the things that I want to highlight to you leaders. When we go out to our people, our prospects, that's one of the selling points that even dentists recommend that we use a soft bristle toothbrush. You can even check it on, there's this other show I was so obsessed with called The Doctor's TV Show. The Doctor's TV Show, they actually say that the best toothbrush is a soft bristled toothbrush, not the medium, not the hard. You're going to brush off your gum, you're gonna brush off your enamel. Teeth don't grow back, right? Right, important. Obvious, our mouth freshener. Remember last week I showed ladies how to use it proper. I did not in there. We don't want cross contamination. You heard what bacteria does. It travels to parts and can cause bone pneumonia if it goes to the lungs, can cause something else when it goes to the heart. So we don't want problems. That's why I was freaking out last week when I told you ladies that, oh, please use this thing right. We don't want the bacteria on here to go in there and cause more complications we've never heard of. You know, so and the nice part about our mouth freshener is that it's an immune booster. It's a natural immune booster. It's got white tea. It helps with the gum diseases, your periodontitis. Hey, it's hoa. Remember me, I'm not a doctor. Me, I'm just a retired engineer. Ne? I just research. Ne? Yeah. So some of these language is very foreign to me. Ask me about gaskets, pumps, valves, screws, stuff like that. Yeah. So it's a natural immune booster. Yes, it keeps your mouth fresh, but over and above that, it's also antibacterial. And remember, it's there. This is why I'm teaching you. I had to take it from the back so that you understand why our mouth freshener is so important. When you think about the bacteria, and now you've heard what bacteria can do. It travels, it might get into your bloodstream and go to other body parts, and then we have a problem. Mpilo, obviously, he's 8. But after a certain age, you stop growing, I guess. After 25, you stop growing. So when you're 25, have you seen someone who lost a tooth? Did their teeth grow back? If it grew back, I really want to know that person. And I took out a tooth last year while I was working there in construction. Right at the end, I took out a tooth. It's still like, there's no tooth. Teeth don't grow back. Okay, so our mouth freshener, it's also good for people who are nauseous. Okay, so it's good for your overall health. It's good for your overall health. That's why we have the Health Hub show. I need to make you understand why I became a product specialist. We did not go so deep into our products so that we understand things that this is linked with this. Who would have thought that poor oral is linked with these diseases? Who would have thought? You know, we need to understand certain things so that we are better equipped, so that when you speak to, let's say, a sugar diabetic patient, then you can tell them that, hey, our toothpaste does not does not spike up your blood sugar levels. It's a selling point. Our toothpaste is antibacterial. The bacteria in your mouth can travel to other body parts and cause complications that we don't want. That's a selling point. Hello? Alangutwa. Are you hearing me, ladies? Are you hearing me, guys and girls? for adults especially. Who says, oh yes, it does grow back, darling, if it falls off, but when broken, it does. Now, my leader, I took out my tooth last year, July. It didn't grow back. It depends person to person, but I'm a testimony. I still have the cavity. They didn't grow back. Okay. Right. Doesn't spike sugar levels. I was talking about this, man. Right. And then remember with our mouth freshener, remember it also helps fight your acute respiratory infections. Acute respiratory infections, I get it, they are in two. You've got the upper, you've got the lower. So which season are we in now? We are in the respiratory infection season. We are in winter, we are in the pandemic. So there's so many ways to sell our products. I'm just showing you, okay? And then calcium, you need to fortify your teeth. You need to fortify your system, actually, because calcium is not only used by the teeth, right? So calcium is also excellent for dental health. For those who came in and were here when I started teaching, you understand that calcium is really important, even the other shows. You know, calcium is also very good for dental health. We need to link these things, understand how the body works. All right. So there's other people, they get cracked teeth, sensitive teeth, because what, they don't have calcium. Oral health. Okay. And then another product that's good for oral health is our green tea. It's also antibacterial, like it. Our green tea, it's super, super. I hope we are learning, we are together, ne? Yeah. No, we stop growing when you get to a certain age, guys. From 25, there are certain things. Yeah. Yeah. But obviously, it's called milk teeth. I get it. It's called milk teeth. Then they go out. Then the adult one comes out. I get it. It's called milk teeth for a reason. You will never find a 30-year-old man who's got milk teeth. Come on. Let's be realistic now, leaders. Ne? So green tea is also good for oral health. It promotes oral health as well. Besides the whole, it's calming, no? Yes, leader Ashi, thank you, my leader. Oh, yes, ne? So it's good for oral health. It's also antibacterial. Like we said, the bacteria in the mouth, they need to be balanced. Okay, it's also good for respiratory infections. So green tea, awesome for oral health. Awesome for blood sugar levels. What did we say about blood sugar? With our sugar diabetic patients, they are more prone to having inflammation, to having gum disease. Our products are the best, guys. We just need to know how the body works, that we can link these things. Obviously, and another one. This is the one I started with, right? The Artemisin mouthwash. But we've got another mouthwash, right? But I'm just doing this for elaboratory purposes. Now English is running away again. Yes, for elaboration, that Longrich has the products. Daily consumables. Who is not your customer? Who is not your customer? Please tell me. Especially, I'm talking especially to leaders that say, I can't talk to people. I'm going to be straightforward with you. When we say you can't talk to people, you are basically telling me that you do not care about your neighbor. That's what you communicate to me. Because so how many people have got sugar diabetes? If you are in let's say in a mall, or if you're at work, or if you're in a taxi, how many people are in a taxi? In South Africa, it's about what? 15 people in a taxi. Of the 15 people, you want to tell me you can't find one client? High blood pressure is rife in Black people. Sugar diabetes is very rife in Black people, especially in Africa. There are 6 million people in South Africa alone walking around not knowing that they have sugar diabetes. In Africa, 60% have sugar diabetes. of the adult population, and you want to tell me you don't want to talk to people. My leaders, please know, when you are a Longrich member, it is your duty to come and save lives. People are, you see, even with the dentist, there's not even, what do you call it? There's not even, oral health is a pandemic on its own. We don't even have enough dentists, by the way. Let me give you the stats on the dentists. I almost forgot about the dentists. Let's see if, 400 million people suffered from some form of oral disease in 2017. And these are stats given by WHO? World Health Organization. Always make the World Health Organization your point of reference. Sometimes send these stats to your clients. Okay, it was on my phone. But Africa, we don't have the budget. Oral health is not like a priority. So in comes you and me with Longrich products. We don't have enough dentists, ladies and gentlemen. We don't have enough dentists. Okay, I can't look at that. We don't have enough dentists in South Africa. We don't have enough dentists in Africa. We cannot say. So when you look at it from that point of view, take your products. If you use the Longrich toothpaste, the Longrich product, less visits to the dentist. Remember, when we visit to the dentist, obviously, we have to go there every 6 months. But other people have to go to the dentist more than twice in a year because of complications. In come Longrich products. Let's know how to package our products. Let's see, my leader, what are you saying? Your data must talk for those who can't talk for themselves. But if others can, what stops you? Your data is your invoice. Thank you. Posting 4 or 5 products a day. Making nice, informative videos, short Nyana videos. I've asked leaders, I've encouraged you leaders to make videos of your own. Use the social media platforms. People are sitting at home. Our alkaline pickup is also great for oral health. Remember, it's got N-ion, it's antibacterial. Remember, we're trying to flush out the bacteria. Please remember, the reason why we use the mouthwashes is because bacteria sit on the lining of your cheek, on your gums, where the toothbrush can't necessarily, be effective. That's why drinking your alkaline pickup, using the mouthwash, the toothpaste, it will help you. Are we together, great leaders? Are we together? I think I'm done. I spoke about, there's no product sitting behind. I'm done, my leaders. We can ask questions now or give your feedback. My 11-year-old boy, his milk tooth, we were all off them. Now his adult teeth are yellowish and we are using our toothpaste. And that yellowish, take care of yourself, guys. Oral health is of utmost importance. Right now, after the show, if you haven't eaten, okay, like myself, I haven't eaten dinner. After dinner, I'm going to brush my teeth. Do you know now with COVID? Hi, Google. Okay, you'll have to replay my scat. It was found that adults are not practicing good dental health. And we are getting other complications because of that. I used to have bleeding gum and brownish teeth. Longrich toothpaste solved that problem. My leader, I need you to inbox me. Leader Eshit, I need you to inbox me. Please, inbox me. We need to, this testimony. Remember, we also have a testimony page. The other thing, the leaders who still say, I can't talk to people. Remember, guys, last week I said, our products will never grow legs, and take themselves to the people. This is why we are here. This is why we are distributors. This is why we need to pump in those PVs so that we get paid every week. This is why we need to maintain and upgrade using our phenomenal products. I think we need to change or adjust or elevate people's thinking. When you upgrade, when you maintain. These are products you can sell. Go to the schools. Go to the schools. Go to the teachers. Give your business plan. Google, just go Longrich testimony page. Yeah, Longrich product testimony. Yes, Longrich product testimony. You understand? These are products we can easily sell in schools, even for the kids. You package your business plan. You go to the schools. This, guys, calcium, you can package it the way you want. Our teachers are highly stressed, right? You can make a stress package and inform them that, did you know this stress package is also good for oral health? And you teach them about oral health. Do your own research. Teach them about oral health. You can make this the stress buster. I don't know. I'm just giving you ideas. Go to the schools, please. You can even sell the teas in sachets. Maybe you'll do this, right? Thank you so much, Claire Palesa. Thank you, my darling. Is it Palesa? Mahalifa? Babes. Oh, babes, is it you? So you can make this, and you put in, let's say, maybe 3 packets of our teas. Make it sellable. I don't know if you get me. And sell it and say this combo is 150. I don't know. It's up to you. We need to think out of the box, guys. The product will not sell itself. The product will not sell itself. You get more customers. This means you've got more money. You keep the profit. You go to restock. You get the PVs. We cannot be closing on zero when there's so many people having problems. You had 400 million people in 2017 were having complications because of oral health. 400 million worldwide. You want to tell me we don't even have 1 million? Easy. Sugar diabetes, yes, kombonyana. Do your own combos. Buy the Longrich, our green tea or brown tea, right? You package this mouth freshener with 2 or 3. Actually, the nice part, that's the other nice part about our teas. They are reusable. You tell them that, Mama, actually you're going to schools. These people are very stressed. This also helps with stress. Do you know that? I don't know, has there been a leader who was stressed and they sprayed their mouth with this? Now I feel different. I actually use this for stress as well. I even do it on my temples. I spray it on my temples here and massage. That's something I keep forgetting, leaders, but I think I've mentioned it last year sometime. Okay, so mouth freshener and 2 or 3 of our tea bags. And then you say this is a combo, 100 rand, 150. I don't know. It's up to you. You package it the way you want. Yeah. We need to think for our people. They don't know about our products. So you package it. You can even do you do this combo and give the benefits about the buying the right toothpaste, not toothpaste, man, the right toothbrush. That a soft bristle toothbrush is the best, recommended by dentists. Soft, because people brush away their enamel, they brush away their gums, they have gum disease, and then what happens? A person can have heart complications because of that. I think I was very clear. Can make combos, guys. Let's think out of the box. Right now, spring is coming. Spring is coming. We all know that people love to gym. People, they love to gym. Moto knows very well that I want to be sexy in December. They will start training in November. Make that, you can make can call it a sexy combo, Leader Zippo, I sprayed in my mouth, and I also on my temples. And then I massage it. There's a big difference, I must say. Very clear. Okay, thank you, Leader Refile. What help for mouth ulcers? Leader Trina, our spray, our toothpaste, alkaline pie cup. Yes, spring is coming, guys. Spring is Today's the 23rd. Spring is just now. This week, your homework, think out of the box. Think about what people love to do in spring. They love challenges. They love to lose weight. You know, they love to feel good. The whole aim, the other thing is that our products make people feel good. You know, you can do the feel good combo. You can call this the green tea. Yes. Instead of for stress, you can call it the feel good combo and do your selling points, but be effective, you know? Okay. Any other questions, my great leaders? So mouth ulcers, this my leader Trina, our mouth freshener, our alkaline pickup, our Longrich toothpaste, white tea toothpaste. Okay, for mouth ulcers. So my leaders, we are so sorted. We are more than sorted. We are more than sorted. So today tonight, now, remember I said what? If you haven't eaten, you eat your dinner and you go brush your teeth. Because we need to brush our teeth twice a day. Twice a day. There's still a few minutes. Do you want me to recap, my leaders, again? Do you want me to recap? Or are we good? SDT, my personal SD. Google, when you need to learn time, you are a stout child. You know, in class, there was always this child that was not. Okay, let me recap. I'm going to go fast, ne? I'm going to go fast. Yeah, we need to really... our products are amazing, guys. Let me go through this. What's the connection between oral health and overall health? Like other areas of the body, your mouth teams up with bacteria, mostly harmless, but your mouth is the entry point to your digestive and respiratory tracts. And some of these bacteria can cause diseases. Normally, the body's natural defenses and good oral health care, such as daily brushing and flossing, keep bacteria under control. However, without proper oral hygiene, bacteria can reach levels that might lead to oral infections, such as tooth decay and gum diseases. Also, bear in mind that certain medications, such as decongestants, flu, decongestants, antihistamines normally used by the allergies, for inflammation, painkillers, diuretics, and antidepressants can reduce saliva flow. Saliva washes away food and neutralizes acids produced by bacteria in the mouth, helping to protect you from microbes that multiply and lead to disease. Studies suggest that oral bacteria and the inflammation associated with a severe form of gum disease called periodontitis might play a role in some diseases. And certain diseases, such as diabetes and HIV/AIDS, can lower the body's resistance to infection, making oral health problems more severe. These things are connected. So I won't go too deep into this, but I'll name some few diseases. What conditions can be linked to oral health? So what conditions can be linked to oral health? Endocarditis, this is an infection of the inner lining of your heart chambers or valves. Typically occurs when bacteria or other germs from other parts of your body, such as your mouth, spread through your bloodstream and attach to certain areas in your heart. Number 2, cardiovascular disease. Although the connection is not fully understood, some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. Number 3, the conditions linked to oral health. Remember, pregnancy and birth complications. Periodontitis has been linked to premature birth and low birth weight. Pneumonia, number 4, pneumonia. Certain bacteria in your mouth can be pulled into your lungs, causing pneumonia and other respiratory diseases. I will end it there. Do we see how serious this thing is? Wema. Gugu, you are always late. Weda, you are always late. We'll target the path. Anything for bad breath? I love this question. Leaders, please listen to how I'm gonna address leader ladies. Leader ladies, bad breath. Are you suffering from any constipation? For the leaders that have been watching the show previously, they understand this line of questioning. Let me address this. Leader ladies, for bad breath, is this person suffering from constipation? Yes, Leader Justin, it's very, very serious. Very, very serious. I encourage all of you to please send this individually to your teammates. Where's Leader ladies? We're waiting for your answer, leadership. You said anything for bad breath. And I'm asking, does this person have constipation? Okay, let's look at it this way while we wait for ladies. Leaders, bad breath. Your body communicates to you. Last week I did speak about bad breath. Leader Trina. Oh, my darling, please get yourself berry oil and the alkaline pica. Please, please, please. That's what I survive on. I grew up with allergies. I have the rarest allergies ever. That's why I love Longrich. It's sorting me out because specialists couldn't help me. Anything for pile? Okay. I'll start with a bad breath. Last week I mentioned that the way your breath smells is your body communicating to you. Some people have a certain breath that indicates that they are pre-diabetic. Some people, it's constipation. Some people with constipation, I explained that what happens with constipation, your stool sits there in your intestines, right, for days instead of you doing the number 2. It sits there. Ne? It's dry around there, right? There's no lubrication. There's no water. You don't drink enough water. Those are the other questions we need to ask our people. Okay, you are suffering from constipation, bad breath. Do you drink enough water? Are you eating right? Are you eating roughage, high fiber diet? Fiber plays a role in constipation as well. That's why I love our teas. They are high in fiber. So what happens with the stool that's sitting there for days? It ferments, right? And then it goes back into your bloodstream, okay? And obviously that's, I mean, it's stool. It smells chachas. Hence, you have the bad breath, the smelly armpits, or smelly body odor. So constipation is very serious. I wish that people could actually, it's not, I'm constipated, it will be right in a few days. If I told you, I should actually have a lesson on constipation. Actually, it can lead to cancer. Okay, anything for pile, my leader? Our toothpaste can help for piles. The N-iron strip, our green strip, can also help. You put it there. All right. It can also help. Yeah, piles as well. Same case as constipation. Very serious. Can also eventually lead to colorectal cancer. Constipation and piles is not 1, 2, 3 ounces blood. So for piles, my leader, please, the person must also check their diet. They must check our green tea, maybe brown tea as well. Oily. Leader Tina, oil. I didn't speak about oil leadership. Welcome, Leader Nkululeko, listening from Zimbabwe. Welcome, leadership. Yes, leadership, you can try for pulse. Yes, green tea as well. Remember, this is the other important fact. Leaders, can we please learn the basic of our products? Green tea is known as the constipation tea. Brown tea is known as the, unfortunately, it's in my kitchen. I'm not going to get up. And the other tea. Brown tea is known as the tummy reduction tea. Okay, for liver fat. Tummy reduction tea. Pink tea is known as the weight loss tea. Let's do let's get the basics right. Let's learn our products. At least know the basics. That green tea, constipation; brown tea, tummy reduction tea; pink tea, weight loss tea. For allergies. Oh, my leader, I said berry oil and you see. Thank you, Onalina. Yes, berry oil and alkaline backup, my leader. You can also crush the berry oil and apply it directly to your skin. That also works magic. For pile, brown tea, cordyceps, a lot of water. Leader Karen, when you say cordyceps, do you mean, can we please learn how to talk as well? Remember, we've got how many cordyceps? We've got cordyceps coffee. We've got cordyceps supplements. Let's please also get the jargon right so that there's no misunderstanding. Oh, wow. Wonderful, Leader Crystal from Cameroon. Wow, wonderful. Wonderful, wonderful. Leader Lebukhan said the teas are sorting me out. Constipation is a thing of the past. You see, now your testimonies are coming here and you all have my numbers. Like, what is wrong? What is wrong? We talk every day, but the things that really matter, the testimonies, guys, our testimonies sell. They're just some customers who are Thomases, So you send the testimony link of any, like the constipation, you send it to the Thomas customer or the Thomas prospect. Constipation and pregnant women leadership, as we can suggest teas. Where did pregnant come from now? Did I miss it? Or you are asking constipation on pregnant women. Remember, our alkaline pickup also helps with constipation. I think we forget about the alkaline pickup helping with constipation. Yes, woman, if there's one leader that is like this when it comes with testimonies, I don't even ask her. She inboxes Leader Onalina. Leader Onalina. And she's working. And she's nursing. She's a breastfeeding mommy. She's busy for days. Mother, she will remember that. Let me inbox her. Okay, testimonies are coming, my leader. Remember, me and patients are not good friends, eh? Me and patients, oil and water. Yes, my leader. So let's remember, alkaline pickup is also great for oral health, for constipation as well. And drink the water warm. Okay. Bona Zippo. Zippo, you are one of the guilty ones. I've been waiting, I think, for 5 months for Zippo's testimony. I'm outing her now. I've been waiting and waiting. I've been inboxing Icon. Our coach is too busy, guys. Especially now she's a stockist. We are dead. Yes. Well done, Leader Onalena. She remembers a whole breastfeeding mother, working mother, 24/7. My leaders, we have 2 minutes left. 1 minute left. Any other questions that you might be having? Remember, we need to help each other out here. Now I don't know everything. That's why I have to research. Oh, and there's something I have to research. I forgot to research. Oh my goodness. Okay, now I must note it down. Let me write that down. Wait. Yeah. So are we okay, my leaders? So oral health is of utmost importance. We need to remember that we brush our teeth twice a day, morning and night, and we floss and we visit our dentist every 6 months, and we change our toothbrushes. Change your toothbrushes every 3 to 4 months or so, or as soon as you see it doing the banana split, doing the Van Damme split, please. Baba's bongile. Always a smart student, understand what the teacher teaches. I try to be as non-technical as possible, my leaders, because Some things are just difficult. Like, when you hear someone say non-communicable disease and you're like, ah, you're like you. Then we know now that it's your sugar diabetes, your cardiovascular diseases, why born high blood pressure, hypertension. My leaders, thank you so much. Yes, Gugu. Your toothpaste can't be doing Van Damme split when you have Longrich. How? Please, 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 please. We need that. We need to do that. So, my leaders, thank you so much for your time, Mihle. I really appreciate every one of you coming here. You make training fun, I must say. You make training so much fun. Yo, my leaders, thank you so much. It's now 8:01. Let me love and leave you. We will see each other next week, We'll talk next week and via inbox, Thank you so much, my great leaders. Remember, I also have a YouTube page. You can please like and subscribe to it. We've got the testimony page, right? And then I also have a show, right? That goes every Wednesday. So feel free to check whatever. Learning. We can never learn enough. Leader Etienne, I don't know if I'm saying it right. No, thank you so much, great leaders. See you next week, Monday, 7 o'clock sharp. Gugu, I'm going to phone you from now on at 10 to 7. Bye. Love you.